Hello everyone, Mercy here. I am a doctor of nursing practice. Let's continue our A to Z series of mental illnesses, mental health disorders, or any issues impacting our mental health. You pick the topics and we talk about it. For this one, the majority was gratitude. We are in our G word. Remember, G word. The majority was gratitude, but we feel like we've talked about gratitude endlessly. If you could watch our previous videos and shots on YouTube, we talk a lot about gratitude, how it impacts our mental health. So the second G word of choice is gambling disorder. So let's talk about gambling disorder. Gambling disorder or gambling addiction is also known as gambling disorder or compulsive gambling. It is a serious mental health issue characterized by an inability to stop gambling despite all the negative consequences. Despite failed trials, you are still gambling. Do you guys know that it is ranked as one of the top mental health issues in the US? People have gambled their homes away, their houses away. People have gambled their salaries away. People have gambled money that was meant for their kids' food. People have gambled. They are even living in the streets due to gambling. It becomes a disorder when it becomes an obsession, and you cannot even stop it despite different trials or seeing all the negative consequences. Let's talk about gambling a little bit. Gambling addiction, also known as compulsive gambling or gambling disorder, is a serious mental health condition characterized by an inability to control or stop gambling despite negative consequences. It is recognized as a behavioral addiction, and like substance abuse disorders, it can have significant impact on a person's life, relationships, and overall well-being. Here are some key points to consider when discussing gambling addiction. Definition and criteria. Gambling addiction is included in the Diagnostic and Statistical Manual of Mental Health Disorders, which is used by mental health professionals for diagnosis. Criteria for gambling disorder include a preoccupation with gambling, the need to gamble with increasing amounts of money to achieve the desired excitement, unsuccessful attempt to stop or control gambling, and continued gambling despite negative consequences. People engage in gambling for a variety of reasons, and motivations can differ from person to person. Here are some common reasons why individuals may choose to gamble. Entertainment and excitement. Many people gamble for the thrill and excitement it provides. The anticipation of uncertain outcomes and the possibility of winning can be exhilarating. Socializing. Gambling is often a social activity. Many people may visit casinos or participate in friendly poker games as a way to socialize with friends and family. Escape and relaxation. Some individuals turn to gambling as a form of escape from stress, boredom, or everyday pressures. The immersive nature of gambling activities can temporarily divert attention from life's challenges. Financial gain. The prospect of financial gain is a powerful motivator for some individuals. They may see gambling as a way to make money quickly or to improve their financial situation. Skill and strategy. Games that involve skill and strategy, such as poker or blackjack, attract individuals who enjoy the challenge of using their expertise to influence the outcome. Coping mechanism. For some, gambling serves as a coping mechanism for underlying emotional or psychological issues. It may temporarily alleviate feelings of anxiety, depression, or loneliness. Peer influence. Social factors, including peer pressure or the influence of friends and family who gamble, can contribute to an individual's decision to engage in gambling activities. Cultural or societal norms. In some cultures, gambling may be deeply embedded in social norms and traditions. Individuals may participate in gambling activities because it is socially accepted or even encouraged. Advertising and marketing. Aggressive advertising and marketing by the gambling industry can also contribute to increased participation. Promotions, bonuses, and the portrayal of gambling as a glamorous or exciting activity can influence people to try their luck most of the time. Compulsion and addiction. For some individuals, gambling may start as a casual activity but can escalate into a compulsive behavior or addiction. Factors such as a predisposition to addiction, neurobiological factors, and environmental influences can contribute to the development of gambling disorders. Understanding the diverse motivations behind gambling is crucial for designing effective prevention and intervention strategies. While many people gamble recreationally without negative consequences, it's essential to be aware of the potential risks and negative impacts, particularly for those who may be vulnerable to developing gambling related problems. Responsible gambling practices, education, and support for individuals facing gambling issues are important components of a comprehensive approach to addressing this complex behavior. Risk factors. Various factors contribute to the development of gambling addiction, including genetic predisposition, neurobiological factors, environmental influences, and psychological vulnerabilities. Some individuals may be more susceptible to gambling addiction due to a history of trauma, depression, anxiety, or other mental health disorders. Impact on mental health. Gambling addiction is associated with a range of mental health issues, including anxiety, depression, and increased stress. Individuals with gambling disorders may experience feelings of guilt, shame, and a diminished sense of self-worth, especially if their gambling activities have led to financial or interpersonal problems. Financial consequences. One of the most visible and immediate consequences of gambling addiction is financial hardship. Individuals may accumulate significant debt, experience job loss, or face legal problems due to their gambling activities. Interpersonal relationships. Gambling addiction can strain relationships with family and friends. Deceptive behavior, broken promises, and financial instability can lead to trust issues and strained connections. Treatment options. Treatment for gambling addiction often involves a combination of psychotherapy, support groups, and in some cases, medication. Cognitive behavior therapy is commonly used to help individuals identify and change distorted thought patterns and behavior associated with gambling. Prevention and support. Public awareness and education are essential for preventing gambling addiction. Initiatives that promote responsible gambling practices and provide information about the risks associated with excessive gambling can be beneficial. Support groups such as Gamblers Anonymous offer a supportive environment for individuals struggling with gambling addiction to share their experiences and receive encouragement. Professional intervention. Mental health professionals play a crucial role in the assessment, diagnosis, and treatment of gambling addiction. Interventions may include individual therapy, family therapy, and collaborative efforts with other healthcare providers. It's important for mental health professionals to approach gambling addiction with empathy, understanding, and a non-judgmental attitude. Effective treatment often involves a holistic approach that addresses the underlying psychological and emotional factors contributing to the addiction.